This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
So, a question for you here. Have you ever gone about your day and you just had to stop for a moment because you think that your eyes are playing tricks on you? You don't just see one of something like a coffee cup. Maybe you see two of them or maybe three of them, maybe even more. We're not saying that you had too much to drink. It's nothing like that. You, my friend, could be dealing with double vision. It's a condition that you need to take seriously. And as a matter of fact, joining us today to tell us why is Dr. Catherine Smoot, who is a board-certified ophthalmologist with Chesapeake Eye Center. Thank you so much for coming in today.
Thank you.
So, is double vision, I mean, is it exactly what it sounds like?
It is. It is when you see two images when you should only be seeing one. And they may be just slightly apart, or they could be wide apart.
Okay, so, and I think we kind of put together a little example here for you. See that great shot of Sean. Oh, looky there. So that is what you would consider double vision right there.
It is, and the interesting thing about that shot is that a lot of times people would describe double vision as blurriness or blurring of their vision. So they may not even figure out that they're seeing two,
right?
But that things just look blurry. They're not right.
Just not sharp.
Not sharp.
So what can cause this?
There are many things that can cause it. The first question is it happen when both eyes are open or when only one eye is open? If it's double vision and only one eye, like if you close one eye, you still have double vision.
Right.
Usually that has to do with a refractive problem, the way the light is bent coming into the eye. So it could be a problem with the cornea, the cornea scarring, infection of the cornea, what we call keratoconus, where the cornea is like a football,
right.
Can cause double vision. It could be something in the lens of your eye, such as a cataract formation. Anything that affects the transmission of that light through the eye could cause double in one eye.
So what if you're seeing it with two eyes?
If you see it with two eyes, that's a different problem. Now we get into the fact that the eyes are not aligned straight ahead. They should be like a team of horses straight ahead. If they're not, if one horse is pointed out or pointed in, or they're not focused on the same place, you'll see double vision because each eye is like a camera.
Right.
Okay, and they have to be looking at the same thing. They send those images into the brain, and there's a part of the brain called the striate cortex that takes those two images and makes them into one.
Okay.
So things that can affect double vision when it's two eyes, usually starting from the front of the eye to the back, muscles.
Okay.
If there's a problem with the muscles, that'll affect double vision. There's certain conditions that can affect your muscles, such as thyroid disease can cause double vision. And that's a tough one because it makes the muscles big and they can't move, and
right.
you can have double vision all kinds of directions, and that's very difficult. Myasthenia gravis, multiple sclerosis. These are some of the medical conditions that can lead to double vision. If you get further back in the brain, you have to think of things such as aneurysms, pressing on the nerves that control the eye. You have to think of tumors. You have to consider microvascular events such as mini strokes. That's very common in senior population, especially as people have diabetes or high blood pressure. Little teeny vessels can block off, affect the nerves, and misalign the eyes.
So something as simple as double vision could actually be indicating a whole lot more.
It absolutely can. And so when there's sudden onset of double vision that involves both eyes, it's really important to see your ophthalmologist because we want to get a good history. Is it up and down, side by side?
Right.
Did it happen suddenly? Has it happened gradually? Have you had headaches with it? There's inflammatory processes that can lead to acute onset of double vision, such as infections or inflammation of blood vessels. We work very hard to try and get to the bottom of what is causing the double vision. So
what should we do in the moment? We see it starting to split like we saw on the screen. What do we do at the moment?
At that moment, call and get an assessment, and so we can figure out what the possible causes are. If you have a history of, like, say, diabetes or high blood pressure, you're a little older, we'll probably just watch that. Especially if you say your blood pressure's been up, it'll probably resolve on its own.
Okay.
However, if you come in and your eyelids drooping, you say I've had a terrible headache, you're going to go straight for like a MRI scan, trying to see if you have an aneurysm or a tumor or something else serious causing that. So a lot of what you tell your ophthalmologist is going to affect how we approach that condition.
What if it's not? What if it's not a temporary thing? I mean, what if it's not a permanent thing? What if it's just temporary? In other words, it splits and then it comes back together again.
Again, you'd want to find out what's causing that. We have a lot of cranial nerves that run through our brain. They're like the super highways of neurologic inflammation in our body, if you will. And a lot of those cranial nerves we see by eye muscle movements. So cranial nerve 4, 3, and 6. 3 out of 12 cranial nerves just affect eye movement alone.
Wow.
So chances are it's one of the nerves, if it's just kind of coming and going, is being aggravated by something.
Yeah.
Whatever it is, inflammatory, microvascular, generally those things will kind of resolve on their own. If it's something compressive, a lot of times you'll see a gradual worsening, and we want to try and sort those things out.
So something simple could mean a lot more.
It could mean something very serious. And so the question is then, what do you do in the meantime?
Right.
Again, depends on what that assessment is. If we think it's going to be temporary, a lot of times we'll say, patch one lens of your glasses and just use one eye and try to get past the aggravating part while it gets better.
Right.
If it isn't getting better after 3 months, we might do extensive medical workup. If it's not going to get better and it's persistent for months, we can fool you by putting prism in your glasses.
So there are plenty of options available.
And the ultimate one would be surgical. So,
Dr. Catherine Smoot, thank you so much.
Thank you for having us.
For showing light on something
that
simple
people
that
don't
could
think
be a lot
about.
more. Yeah, exactly. Thank you very, very much. Now, if you'd like to learn more from Chesapeake Eye Center, all you have to do is go to DelmarvaLife.com.